Hello, my name is Gillian Samuel and I'm the Public Involvement Coordinator and Peer Researcher from the McPin Foundation. I'm here today with Alex Lewington, Senior Peer Researcher, and together we are going to talk about our exciting and innovative peer research Photovoice study, Experience of Mental Health and Structural Inequality. Slide 2. This presentation will focus on two aspects of the study. Firstly, we'll take a deep dive into why we designed the study the way we did, why being peer-led was important, why we chose the Photovoice method, and why Lambeth and Harrow, our two chosen London boroughs. Secondly, we will be asking what we have learned so far. Slide 3. Our study began in September 2020. It came about as a result of the peer research team who had worked consistently across phase 1 of the National Institute for Health Research Public Mental Health Programme from March 2019 to September 2020. Now, important to note was that at the end of phase 1, we discovered that inequality was the most common theme that appeared throughout our public consultations. For example, some people spoke of debt and poverty, others of housing insecurity or difficulties with the benefits or health system. In one way or another, structural and systemic inequalities recurrently surfaced. The more we spoke with people, the more we realized the impact that this was having on their mental health. We learned that there were gaps in research, knowledge of how, in their own view and in their own words, people experienced inequalities. What experiencing inequalities means to people's day-to-day life, how it affects them and their communities, and what their priorities are for change. We believe that it is with such knowledge led by and generated by people themselves, we could uncover new findings and interpret existing data from a new angle. And so our study was born. Slide 4. Our approach was carefully considered amongst our team. We are a team with lived experiences of poor mental health. We would explore our own experience of inequality so that we can tune into our peerness during the project, which would bear more authentic and meaningful results. We would also use the contacts that we had in the areas that were familiar to us, namely Harrow and Lambeth. Through our contacts, we advertised the opportunity to take part in the study. We invited people to take a few photos of what inequality means to them and to send them to us. This proved to be a very useful tool from which to base discussion. Then we interviewed the participant, either on Zoom or in person, asking a range of questions designed to open conversation about their experiences of inequality and mental health. After each interview, we write reflection notes, how we as peers with lived experience relate to the interviewee and how we used our peerness in the interview process. Our team together are now in the process of analysing the interviews and starting to identify themes. Slide 5. Here you will see our current team of 6 peer researchers. There's me, top left, and Alex, top right. It may be useful to note that our team has changed over time, but we have been able to adapt to accommodate the loss of some original team members with the replacement of new. It's important to be flexible as a team and allow for the transient nature of people. Slide 6. This is Laura Fisher, who was the previous public involvement coordinator and researcher. In her own words, our work helped move forward peer leadership by being initiated by us within an environment that was not led by lived experience. It was university and academic led. We heard what people attending our workshops were saying, excuse me, what mattered to them, and we recognised that this wasn't addressed in the programme. Instead of accepting this, we proposed to take leadership on this, and we designed our own study. This was important, not only because it responded to a clearly identified need, but also because it made a statement that lived experience can and should be among the leadership of research. Slide 7. This is Ollie Jones, who was a peer researcher and part of the original team. I invited him to tell us how his lived experience shaped this project and why did the peer research method take him to Harrow and Lambeth. Play the video.
So I think there's sort of two perspectives here that I can kind of bring. And one is from my own perspective, my own lived experience in mental health. And then the other is part of the work that I was doing and the people that I was working with as part of a community-based mental health project. So I guess I can start from my own perspective. I have lived experience of psychosis. And in the area of Lambeth, it's actually one of the areas in London that has some of the highest rates of experiences of psychosis across the country. So in that respect, I felt like it was an area which I can relate to personally from experience, and I know that it's a sort of it's a mental health experience that is exacerbated by some of the inequalities, structural inequalities, but it also could be caused by them, related to them in a very sort of intimate way. So I felt that yeah, that's one of the reasons why Lambeth was important to me. But the other being that I was involved in a community-based mental health project that's trying to reduce the impact of digital inequalities. So that lots of people lack access to the internet and don't have much confidence in their abilities online. And so I was working with people in the community and seeing the sort of problems that they were facing and thinking, you know, this is quite relevant to the subject matter that we're trying to sort of learn more about. And in Lambeth, it's a very diverse area. There's you know, there's a lot going on in Lambeth. It's a great area, and there's a large Caribbean population and African population, Portuguese population. It's an area that, you know, we can really learn a lot from the experiences of people that live there. So those are sort of the main reasons for choosing Lambeth, both personally from the sort of mental health perspective, but then also, yeah, the kind of the area itself and knowing a little bit about the area.
Thank you, Ollie. That's really, really helpful. And it's all been about that connectivity that we have as peer researchers with lived experiences. We have the contacts, you had the contacts in Lambeth. I personally had lots of contacts in Harrow. And this was very important in terms of our methodology for this project. Thank you very much, Ollie, for your time. It's been lovely seeing you again. Slide 8. Finally, this is me. To demonstrate how I reflected on my own lived experiences of inequality, I would like to share with you an excerpt from the reflection that I wrote back in January 2020 called Black Sack, One Shoe, Systems That Both Save and Fail. A black sack and one shoe are all I had on leaving the psychiatric hospital. Nothing more. I returned to a house that I barely recognised. It smelt different. It was as if my return was never intended. The system both saved and failed me. Doctors, midwives, health visitors, social workers, psychiatrists, nurses were all aware of my depression, as well as my friends, neighbours and family members, but all failed to either notice or to know what to do with my desperation and my downward spiral into psychosis. Prevention, precious, the most crucial way ahead. In truth, I still have no idea what systems could have been in place to stave off the invisible violence I experienced and hold my broken mind. Maybe if I work hard and contribute to this public mental health research programme, I can help find solutions through research and in finding new ways to build better systems that underpin our lives, then I might also find answers as to what should have been in place to prevent the trauma that changed my life. Who knows, if I look hard enough, I may even find the missing shoe. I'm now going to hand over to Alex, who is going to talk about our peer methods and what we have learned so far.
Thanks, Gillian. In this second part of our presentation, I'm going to reflect on what we've learned about peer research methods over the past months within the context of the Photovoice study. It requires time and effort to be a Photovoice participant. Although the picture-taking process isn't too difficult, it is time-consuming, demands a lot from you. We did practice runs within the team to give everyone a chance to get comfortable with the whole process from recruitment to the topic guide. During that period, I was practice interviewed 4 times, and I quickly realized that reflecting on past experiences on mental health could be both uncomfortable and exhausting. A lot of thought goes into what you share and how you share it. I mean, the task kind of demands it of you. So you become acutely aware of the things you say, how you say them, whether you ever contradict yourself and so on. You occupy a position of vulnerability, you alone within that interviewee dynamic with no expectation that it's reciprocated. Getting a first-hand experience of what it's like to be interviewed about these themes teaches you a lot. It allowed us, I suppose, to create a supportive environment for those who eventually took part, to ensure we were compassionate throughout. We were more mindful of how we phrased our questions, of the tone we used, and saw immense value in drawing on our own experiences when the right situations presented themselves, not just to make participants feel more comfortable or less alone in their vulnerability, but also to remind them that they were talking to human beings who've traveled similar paths and who genuinely care. Sure, they helped us get to know each other better, and in an ideal world, we would have known each other well enough to be able to look at the pictures that participants had sent in and to choose which researchers would conduct which interviews using shared experience or peerness as a gauge. Unfortunately, we couldn't really do that. Gillian's already discussed the peerness days and the reflective days that the team held in phase 1 and prior to COVID, the face-to-face sessions that positively impacted the team dynamics. After lockdown began, the peerness days and reflective days stopped, team members left and new ones like myself joined. These practice interview sessions were nowhere near as in-depth or intimate, so we never really got the opportunity to establish those bonds with one another. It's frustrating because in interviews where there are clear instances of peerness, or more specifically, similarities in lived experiences of inequality between at least one interviewer and a participant, the participant appears more comfortable opening up. Photos are a different way, but a way of exploring inequality, unfairness, mental health. They allow us to see beyond the labels of mental illness. They provide us with something visual, something tangible to look at to better understand the story that's being told. When someone tells you that when they look out the window, they feel like the world's lost its color, you can interpret that in many ways. But when you see these pictures and when you hear what they say, you might begin to understand to a degree why they feel what they feel, depending on your own experiences, on your shared perception of the world as colorless, on your peerness in relation to the participant in these pictures. You might empathize, and so you might pursue a more profound line of questioning. Then again, you might not identify with the participant, so you might just ask, how does that make you feel, and move on. Each picture is intriguing in its own way, and I often find myself anticipating what someone's going to submit. Some photos turn out to be more straightforward. They're powerful because you see exactly what participants want to show you, what they'll be talking about. A hospital, a workplace, congestion, grey cityscapes, broken windows, cardboard boxes, barbed council estates. Others end up being more abstract, but there's an intention behind what's been photographed, whether the angle, the blur, the lighting, the color scheme. In both cases, they pique your curiosity. You actively want to contribute to the meaning making, but the meaning isn't yours to make. So with that in mind, we do our best to cast aside our interpretations of the photos we've been sent, because if we make assumptions or inferences, then we're defeating the point of hearing from participants themselves what their photos represent. That said, we give ourselves room to be curious, because ultimately it's our experiences that steer our curiosities, and our curiosities that lead to questions. Of all the interviews we've done so far, on only two occasions has the interview been conducted by a sole interviewer. Both interviews were conducted by me, and both participants were females over 40 years of age from different cultural backgrounds. In other words, there was practically no peerness between us. Although the interviews went smoothly, there was a reluctance to go into detail on sensitive subjects, and I was unwilling to push. After reviewing the transcripts, we noted points at which another interviewer could have followed a specific line of questioning that I just couldn't have. We noted questions I could have asked that didn't dawn on me at the time, or that I didn't have the relevant lived experiences to see. In these cases, someone with peerness to the participant could have reflected on their own experiences, their own mental health struggles, perhaps shared a snippet of their own lives to elicit further conversation on the topic. One of my colleagues does this extremely well, particularly when participants discuss the ways in which non-UK cultural backgrounds impact them on their willingness to reach out to mental health services for care, for example. She understands them, she identifies with them, and just by affirming their experiences, she encourages them to open up and go into further detail, even if that's not what she sets out to do. So we ended up learning about the cultural barriers between service users and staff that lead to a lack of access to care. Beyond this, there's the fact that having a second interviewer doubles the chances of peerness to some degree. It means that whilst the primary is actively listening and furthering the discussion, the secondary is making notes on the participants' emotions, the atmosphere, plotting missed or follow-up questions. It also means that once the interview is over, there are two sets of reflection notes. So when the data analysis begins, we have double the information. And it does happen that these accounts can be quite contrasted, which again is based on the perspective of the interviewer writing the reflective account. With regards to data analysis, ideally, whoever's gone over the transcript to make corrections and to anonymize would have a detailed understanding of the themes that presented themselves during the interview. You'd list as many themes as possible, many relevant themes as possible, and let the researchers themselves pick the transcript they want to read based on their sense of affiliation to the participant. This ensures that at least one researcher will have some sense of peerness with the story within the transcript. We're early doors within that process. Empathy is a peer researcher's tool, but it has its shortfalls. So while on one hand, empathy helps us conduct our interviews with respect, with care and consideration for those present, it can be overwhelming, particularly in situations where it's not a matter of putting yourself into someone else's shoes, rather of putting your old shoes back on. We have team members who are familiar with the areas in which they're recruiting, like Gillian and Harrow. There are instances in which pictures strike a chord, particularly pictures of places. This doesn't happen too often, but it has happened. Participants have shared some deeply traumatic experiences. They've laughed, they've cried, they've chewed on ice to ground themselves, they've requested breaks, they've needed support. These interviews evoke emotions and can bring up memories of personal experiences that can be difficult to deal with. Empathizing can be triggering, can lead to distress, discomfort, and so on. We've had moments in interviews where we've needed to leave for a short time to recompose ourselves, or where we've cried, because what we hear is almost a retelling of our own lives, or because the sensation the participant describes is one that we know all too well, and it reignites that sensation. Peerness is extremely potent, but it can be a double-edged sword. So safeguarding measures should always be put in place, debriefing should always be available, support should always be at the ready. Anyway, just to round it all off, we're learning all the time, and we hope some of our work is helpful to others who are also using peer research methods. And I'll pass it back to Julian. You're muted, Julian.
Thank you, Alex. Very informative. So just to round things off, we are on a massive learning curve. As Alex said, it's both enlightening and revealing to be on this journey of our Photovoice project. There's still a lot more work to do when thinking about peerness in public mental health research, and we hope to extend our work with new communities, working with more researchers in the next year. Final slide. So thank you very much for attending, and please do keep in touch. This final slide lists the way that you can keep in touch by signing up to our newsletter and involvement bulletin. We've got a Twitter account, Instagram and Facebook, and we'd love to hear your feedback. Thank you very much from both of us for attending today. Goodbye.